Good morning, everyone, and welcome to the third meeting of the Task Force for research specific to pregnant women and lactating women, also known as PREGLAC. I'm Kathy Spung, the Deputy Director of the Eunice Kennedy Shriver National Institute of Child Health and Human Development, and serving as Chair of the Task Force. Thank you. Now Dr. Christie del Castillo-Hegyi for the Fed is Best Foundation.
Thank you. My name is Dr. Christie del Castillo-Hegyi. I'm an emergency physician, one of the co-founders of the Fed is Best Foundation, a nonprofit organization of health professionals and parents whose mission is to research and advocate for safe breastfeeding practices to prevent the complications of dehydration, jaundice, and hypoglycemia, all known causes of brain injury and permanent disability. I've come here representing thousands of families and health professionals to raise awareness on the complications that exclusively breastfed newborns are exposed to in health facilities all around the country. Jaundice and dehydration, also known as starvation jaundice, are among the leading causes of newborn hospitalization in the U.S. and across the globe. The leading risk factor for starvation jaundice is exclusive breastfeeding in the first days of life before full breast milk production. This primarily results from insufficient breast milk supply and secondly from ineffective latch. Starvation jaundice occurs to 10 to 18% of exclusively breastfed newborns in the first month, and starvation jaundice can result in brain injury that leads to attention deficits as well as impaired motor, sensory, language, behavioral, and cognitive development, and even frank global disability. Starvation jaundice can be accompanied by hypoglycemia, dehydration, and hypernatremia, each of which can cause mild to severe brain injury and rarely death within the first days of life. Research has shown that 10% of healthy term exclusively breastfed newborns and 23% of firstborn newborns develop deleterious levels of hypoglycemia by 6 hours of life. Long-term data have shown that these levels of hypoglycemia are associated with a 50% reduction in the ability to attain proficiency in fourth grade literacy and math. The outcomes for hypoglycemic newborns found lethargic, seizing, or poorly feeding are even worse. A recent case series published in the journal Hospital Pediatrics showed that underfed, breastfed newborns with symptomatic hypoglycemia developed significant brain injury on MRI, resulting in severe long-term disability. Why, in 2018, are we failing to safely breastfeed newborn babies? In 1989, the World Health Organization published the 10 Steps to Successful Breastfeeding, which was subsequently translated into the Baby Friendly Hospital Initiative. Step 6 of the 10 steps recommends to give no food or water other than breast milk from birth to 6 months. This recommendation was created with no attention on the actual caloric requirements of newborns, the caloric yield of early exclusive breastfeeding, nor data on the incidence of insufficient breast milk production. The signs of insufficient breastfeeding, namely prolonged crying and nursing, have been normalized in order to increase rates of exclusive breastfeeding at discharge, the quality metric of the BFHI. Newborns who are crying and developing complications in hospitals commonly do not get supplemented until they have developed lethargy and poor feeding from hypoglycemia, dehydration, and jaundice. Furthermore, mothers are sent home before they produce their newborn's full nutritional requirement and are advised to avoid supplementation with no education on the consequences of doing so if breastfeeding is not enough. Data on the long-term neurological consequences of breastfeeding complications have now emerged and show the outcomes for affected infants are devastating. Our foundation has confirmed through research and through meeting with the top officials of the WHO Breastfeeding Committee, Dr. Nigel Rollins and Dr. Lawrence Grumer-Strachan, that the BFHI guidelines have never been tested or monitored for safety. The risks of exclusive breastfeeding and the important role of supplementation to prevent and treat them are not currently taught to mothers in breastfeeding education. This serious gap in patient education results in approximately 228 phototherapy admissions every year, in addition to preventable admissions for hypoglycemia, dehydration, and failure to thrive. Phototherapy admissions alone cost the U.S. approximately $4.5 billion annually, the majority caused by starvation jaundice. The care of a child who sustains brain injury from breastfeeding complications can result in millions of dollars of healthcare costs, and the societal and emotional toll to affected families are immeasurable. Thank you. So grateful to have this opportunity to speak to you, and that people are chiming in and having a kind of passionate response to the subject that we're talking about. I want to advertise that we have tons of research as well as resources for identifying risk factors as well as guiding supplementation so that we do protect breast milk supply on bedisbest.org, which is our organization's website. And anyone who's interested in tackling this problem, we are actively doing that. Currently, we are engaged with a large hospital in a quality improvement program to do just that. We're doing pre-intervention and post-intervention data collection on extensive data, including socio-demographic information as well as risk factors. And the research would be easy. Collect the data before, collect the data after, see what the risk factors are, aggressively weigh babies every 12 hours, do daily bilirubin checks, do universal screening at birth of glucose, because 20% of babies are born starved. So this idea they can hold off for that next meal for who knows how long until the milk comes in is not true. And for those babies that are not diagnosed as starved at birth, the consequences are dire. So I just want to invite anyone who wants to be involved, and if the task force is interested in having prolonged engagement with our organization, we have lots of health professionals, scientists, statisticians, and parents. That's the most important part, I feel like, in research and in medicine in general. Sometimes we don't include the patients. And we have 1,000 parents on Facebook that we support every single day to safely feed their baby. And it's not one form. There's not one ideal feeding. There's hundreds of ideal forms of infant feeding. The most important goal of feeding is delivering enough calories and fluids and micronutrients to achieve optimal health and neurological outcomes. And I want to thank everyone for listening to us today.
Thank you, Dr. Wisman.
I'd like to return to the pharmacology related